Good afternoon. Welcome to today's Medical Center Hour. This is a program entitled Women Changed by Cancer, the Whistle Words Project. I'm Marcia Day Childress from the Center for Biomedical Ethics and Humanities here in the School of Medicine, and we're delighted to see you all here today. Thank you for braving the cold and the wind, and I think we will have a time here together that feels quite warm, quite joyful, quite healing. Whistle Words is a multimedia project that is helping women reclaim their sense of self after a life-changing cancer diagnosis and during and after cancer treatment with the simple aid of a pen or maybe a computer. Whistle Words is local. Developed and deployed in Charlottesville, it's having a real impact here. For women who are part of this project as an adjunct or follow-up to their cancer treatment, Whistle Words' writing workshops can make a world of difference in participants' outlook and their healing, as demonstrated by women's writings in the recently published anthology, Truth, Voices of Women Changed by Cancer. Whistle Word taps into a growing body of scientific knowledge that helps us understand how and why writing about difficult experiences, especially expressing in words the emotions that arise during serious illness and arduous treatment, how and why such writing can contribute to and even speed healing. Curious to know more about Whistle Words and interested too in letting clinicians know about this project so they might mention it to patients or friends, we reached out to Whistle Words co-founder Charlotte Matthews and UVA nurse and cancer survivor and workshop participant Susan Goins-Eplee. They are seated here at the front table, Charlotte Matthews on my immediate right, Susan Goins-Eplee on my far right. In this hour, they will introduce us to Whistle Words, and together, in what may feel like a very short hour, they will help us to explore the healing power of writing. Charlotte Matthews is a poet and teacher, an associate professor in UVA's School of Continuing and Professional Studies. As co-founder of Whistle Words, she has created the project in part out of her own experience with breast cancer. Susan Goins-Eplee is a nurse in the UVA Medical Center on one of the general medicine floors. She had an earlier career as a hospital chaplain here. Indeed, she was our cancer center's first chaplain. Last year, Ms. Goins-Eplee was also a cancer patient here. As part of that journey, she found her way to Whistle Words, and in turn, Whistle Words helped her to find her way. UVA Bookstore is here outside the upstairs entrance with copies for sale of Truth, this wonderful and beautifully covered anthology. We also have available Charlotte Matthews' latest volume of poetry entitled Whistle, What Can't Be Said. And that may give you some hints as to how the Whistle Words Project got its name. There are also some posters associated with the project that are available for sale. Let me note here that neither Professor Matthews nor Ms. Goins-Eplee disclosed any financial conflicts of interest having to do with healthcare goods and services. We will open this program before Charlotte Matthews takes the lectern. We'll open it with a trailer from an in-process documentary film being made about Whistle Words by Betsy Cox, who is behind that video camera there. Please welcome Charlotte Matthews, Susan Goins-Eplee, and our time with Whistle Words. Thank you.
Thank you all very much for taking time on a cold January day to come out. I always start the workshops with silence, and so let us begin now just enjoying a minute of silence. I'm going to start with a couple facts. Dragonflies have 6 legs but cannot walk. The bones of a pigeon weigh less than its feathers. Porcupines float in water. No kidding. A cancer diagnosis is also a fact, made so, confirmed, by imaging and biopsy. For the patient, though, it is far more than factual, more than one-dimensional. It changes everything in an instant and for good. The fact grows tentacles, weaves its way into all elements of the life. It has no beginning, and it has no end. Here is a poem I wrote about that feeling. Driving home after diagnosis. There is a woman throwing ashes out her back stoop onto the late February snow. There is a boy at the top of a seesaw, held there as if unshatterable. Then a truck with aluminum racks passes, carrying enormous sheets of glass, tenuous as a filly's fetlocks. Not 5 miles away, a spring storm mounts, and all the leaves I'd collected for the fox den disintegrate, just like that. I've been asked how I feel about my mastectomy scars. Am I self-conscious, disconcerted, somehow proud? What I feel about them is complex. Certainly they serve as a kind of relic, but I regard them as the work of the surgeons who bent over me in a cold operating room for hours under blazing surgical lights, with steady hands passing lancets, securing sutures, firming clamps. Breathing behind masks, they might have talked about an upcoming holiday, or the moon, or how parking at the hospital had become Byzantine. I am grateful for the artistry of those who stitched me back up so that I could be like the Velveteen Rabbit, patched up, well worn. But that is only physical. From the medical staff, the doctors and nurses and technicians who attended me, I received first-rate, outstanding care. My medical oncologist took on the job of physician, counselor, friend, alchemist, even uncle to my children. They were 7 and 4 at the time, and he'd hand them a few dollars and escort them to the cafeteria when I came to chemo so they wouldn't be present in the room when a nurse started the IV lines. The radiation tech and I became fast friends. Became fast friends. By the 3rd day, we talked to each other in the voices of Scooby-Doo and Shaggy. In the company of those skilled in the healing arts today, I must make clear my incalculable gratitude. Yet, still I was broken, a bit like Humpty Dumpty, and all the king's horses and all the king's men could not put me back together again. But writing could. Writing and sharing what I'd written was and is a powerful ointment. Writing and sharing with those who have gone through something parallel is a real tool. It works. To be with those who are now your tribe, writing together, is curative. Sharing that writing legitimizes what might otherwise be unexpressed feelings of fear, of isolation, of alienation. And that is what Whistle Words is about. That is what we do. Let me tell you a story. It's firsthand evidence of the power of writing in the face of anguish. After the 3rd round of chemo, when the children were at school, my hair came out in startling clumps. It was February, cold and windy. That afternoon, Emma got off the school bus, walked in the door, looked at me, took off her shirt, her shoes, her pants, walked outside, and stood stuck still on the back deck. After about a minute, she came inside and wrote this on the oversized chalkboard that was our kitchen wall. Why is it when you stand outside without any clothes on, you can't feel the world moving. All this done in perfect, fierce silence. It took me a minute to understand, but when I remembered that this was the geography block in first grade, I knew that her teacher must have told the class that the world moves. And whom could she trust now? She couldn't feel the world moving, so it didn't. Her mother no longer looked like her mother, so she wasn't. Her teacher had lied. Her mother was unrecognizable. What if Emma had not written those words? She might have cried or yelled at me that I had changed. She might have run up to her room and hugged her pillow behind a closed door. But she wouldn't have expressed the breadth of feeling that she had. She wouldn't have revealed to me, but more importantly to herself, the scope and depth of what was in her heart. Writing it out released what would otherwise have been pent-up fear and distrust. But she put it down. She shared it. She let a part of it go, and this is precisely what we do in Whistle Words workshops. We write and we share, and it is potent. Like Emma, the women in the workshops are able to say what they genuinely feel. They have the chance to put down on paper the freight of what they carry in their hearts. They share what they have put down in writing with the other women changed by cancer who are in the workshop. In this way, their burdens are lightened. They are heard. Is this as powerful as targeted therapies, the latest chemo regimen, immunotherapy? I would argue that it can be. I am certain that it is as influential and as robust. As this quotation says, any sorrow can be born if it can be made into story. In Whistle Words workshops, we participate in the healing of one another by telling our stories using the solid, dependable tool of writing. There's something deeply inward and vulnerable about living with a cancer diagnosis. You are changed irreversibly. You live with a chronic fear. Think porcelain bowl that's been broken, has cracks, fissures, and is thereby more vulnerable. In stark contrast to that is the fact that in our culture, it is very fashionable to support cancer. You can buy a pink Mixmaster, a ribbon keychain saying choose hope, a sticker saying no one fights alone, or the worst, save the tatas, where the mention of the word cancer is as prolific as ladybugs in spring. And for those of us who do live with it, the unstudied way it is offhandedly brought into conversation is vexing. When someone casually mentions cancer, say like at a barbecue, mentions it like you would a new recipe or blockbuster video, something shines in the dark woods, wakes me up, and I am on high alert, antennae calibrating. At first, I can't be sure what I'll say or do. The conclusion I've come to is I have two options. I can pretend I have no familiarity with the disease whatsoever, or I can feign getting hit by a horsefly and walk away to swat at the open air. And I'm afraid to admit I've done both more than once. The women coming to the workshops understand that feeling at the barbecue. We recognize a kinship, share a kind of solidarity. As workshop participant Elizabeth posits, it makes me feel heard in a world that does not always listen. Why writing? What power does it have that talking doesn't? I'll begin by relying upon Shakespeare's thought that writing supplies a shape and gives to airy nothing a local habitation, and a name. The act of sitting together in silence, responding to a prompt, is a kind of devotion, a meditation in unison. Writing often reveals surprises. It has a way of unearthing what you did not know was there to be quarried in the first place. This clip will give you a glimpse into how a 90-minute workshop unfolds. That was at a workshop called Here for the Girls this past spring. Now I would like to ask workshop participant Wendy Waters to read a poem from the Whistle Words anthology, Truth. This is her response to the prompt, why do you honor? What do you honor that is invisible? Wendy?
Thank you. It's called Sisterhood. Grasp hands with the sisterhood of females who have passed into the next realm, who share this world now, who have not yet materialized. Cherish every woman who created the lineage that made each of our existences possible. We walk forward together, joined at the heart, sweaty palms connected. Every one of us is a goddess in our own right. All-consuming joy, searing pain, matronly embraces, empty wombs, divine offspring, saturated hearts, sisterly solidarity, staggering grief, blinding love, societal guilt, impossible expectations, backbreaking work, overwhelming beauty. We own it all, and we wear the scars to prove it. Sorry. The tired and weary of us draw upon the strength of the legions of female conquerors. The triumphant of us share our fortitude with the women who wilt under the pressure of tribulations. We hold each other up, pull each other out, and push each other through. We cannot be separated. I honor the bond of womanhood.
Thank you so much. What do you honor that is invisible? Filmmaker Betsy Cox and I joined forces a little over 2 years ago. We were already friends from yoga class, and one day in the locker room, I asked her, you know, you're really sweaty after that, so you say anything. I was like, hey, would you be willing to make a short video so I can start offering writing workshops to women, because I think it would be kind of cool. I gave her my book. Betsy creates films for advocacy and to effect change. While the act of writing is empowering, sharing that writing through film can magnify that impact. So our hopes for the film are multifold: to provide a platform for women to speak their truths, to share what they have to say with a large audience, create a much-needed dialogue, and to enable these workshops to be replicated anywhere in the country. Sharon Deal, a longtime friend and workshop participant, will now read a poem from the anthology entitled Lowlands. It is a group poem, a chorus of voices that were in the workshop on that day. Sharon?
Good morning. Lowlands of my life. I'll paint the sky beacon gray, then be still and quiet. It feels like nothing in here, and clouds rise like smoke. Carry me through the stormy discord. There I'll meander. Bring me news of what has happened, of clean linens, dishes being washed. As night falls, I listen, curious, a new state of mind, insistent. Sheer curtains blow. I both want them and not. Rejoice. I can mess up and then start all over again.
Wow. that ending. Rejoice. Such a great ending. I am now going to turn it over to friend and workshop participant, UVA nurse Susan Goins-Eplee.
Good afternoon. Years ago here at UVA, there was a lovely, passionate woman named Erla Hagen who ran our patient education room over in the old hospital. Two things to know about Erla are that, number one, her husband was an artist, and number two, they had potbelly pigs. Now, Erla's artist husband created beautiful ceramic statues that were modeled after, yes, their potbelly pigs. At that time, UVA Medical Center Arts Program had a policy of purchasing original art from Virginia artists and placing it into waiting rooms and hallways and other nooks and crannies so that this place that can be so tragic has a little life and hope tucked into the corners. And yes, we purchased 3 potbelly pigs. And we purchased these statues and we placed them in the periwinkle outside the link next to primary care. After the pigs found their new home, one of our distinguished faculty members was walking down the link, saw the pigs, marched straight into the administrative offices, and threw an absolute fit. How can a major medical institution be taken seriously when there's pigs out there where everyone can see them? Thankfully, cooler heads prevailed. The pigs are still there. I remember walking down the link myself back then one day when I had spent the day caring for people whose bodies and lives were being ravaged by cancer. When I saw the pigs outside the glass in various poses of pigginess, I didn't see something unsophisticated and silly. For one brief moment that day, I smiled, and my heart warmed. What happens in this place can be difficult and devastating. Sometimes we really just need the whimsy of pigs in the periwinkle. Even with pushback at times, this hospital does well, not only with the art of medicine, but the arts in medicine. For instance, how many times have we walked through the atrium of the hospital with our minds on lofty medical things to be brought up short by piano music wafting through the space? Stopping and listening can actually change the beat of the heart. Sometimes in this place, a whole day can be spent without hardly a moment to look out a window. But it's hard to find a place in this hospital where there's not a picture or a painting that can, for just a moment, transport us to another place and time. I've been affiliated with this hospital in one form or another since 1992, not only as a chaplain and a nurse, but also as a mother of a child with special needs, a nursing student, an ethics consultant, and even a School of Medicine clinical faculty member. Many of you here today have been friends and colleagues and caregivers for our family for a long time, and I'm grateful to each and every one of you. I'm happy to have this moment to share with you the impact that this program in the art of writing had on me during one of the most challenging years of my life. A year ago, I had a new role at UVA as a patient. In February, I had surgery for what turned out to be stage 2 breast cancer. The rest of 2018 was spent in chemo and radiation. Being in the front row seat of medical care is both a blessing and a curse. On the one hand, I knew what to expect. On the other hand, I knew what to expect. I wasn't shocked about being diagnosed with cancer. Too many people walk into this place and have their lives turned upside down for any of us to think that we are beyond getting sick. I wasn't shocked, but I was really disappointed. However, those years in chaplaincy and nursing did not leave me empty-handed. I learned a great deal from the patients and families I've had the privilege to serve. First and foremost, I learned the immeasurable value of people who love you and are there for you in the darkest times. That includes not only family and friends and coworkers, but the medical professionals who dedicate their lives to fighting cancer and all the other diseases that threaten our well-being. Another lesson I learned pertinent to our time today really does go back to those pigs and the periwinkle. The art that UVA puts in place in this healthcare setting is not just an afterthought that will improve our patient satisfaction and make us look good. This hospital engages musicians and poets and writers and filmmakers and dancers and painters and other artists to be an integral part of medical care. We don't just show up to this hospital as a group of cells. We show up as human beings in need of holistic care. We are body and soul. That is where art and medicine walk hand in hand. If we forget to treat the whole person, the medical care we give can actually be rendered useless. A depressed, lonely, or terrified patient is not a good candidate for surviving the harsh therapies that we throw at them. What happens when someone's depressed? They sit down, take to the bed, stop moving. When a patient can't ambulate or reposition or turn, fluids pool in the body. Pooling blood becomes blood clots. Pooling urine becomes infected. Decreased circulation causes bed sores. Or there's the other extreme, when one is really anxious. Everything is ramped up, muscles tighten, stomach releases acid, and hormones in the body go into fight or flight mode. Neither of these states are good for healing. In fact, these symptoms left unaddressed can be deadly. Pills and infusions, while crucial for survival, are not effective alone. We need more. The painter George Braque said, "Art is a wound turned into light." Dr. Rachel Naomi Remen said it this way: "At the deepest level, the creative process and the healing process arise from a single source. When you are an artist, you are a healer. A wordless trust of the same mystery is the foundation of your work and its integrity." When I became a patient, I knew that my body and soul needed tending in order to endure the treatments I was facing. When I came to my pre-surgery visit, Carmel Nail gave me this lovely little notebook filled with information about cancer and a really pretty journal. The journal sat on my bedside table for a while until one day I picked it up to see what would come out. After years of being a wordsmith and a chaplain, I knew it would be profound. I picked up the journal, opened the page, picked up my pen, and wrote these words: "Effing breast cancer, really? Question mark, question mark, question mark." I didn't say effing. I closed the journal. I could not find words. Betsy Cox had hardly gotten the words of invitation to Whistle Words out of her mouth when I said, "That's it. That's what I need. When do we start?" I knew I needed something to cajole out of me what I was obviously having trouble finding the words to express. Words are a funny thing. They are spoken to us and we speak them. Sometimes words are just bouncing around in the recesses of our minds and hearts. But in a crisis, they can just be all a jumble, and it's difficult to hear or say anything. These workshops are not just an opportunity to hone our journal writing skills. They are time to be in the presence of amazing women and discover what we didn't even realize we needed. I walked into the first meeting as fragile and broken as I was throughout my whole treatment. That week, I'd shaved my head, as my hair had started to succumb to the chemotherapy. The Whistle Words workshop was the first place I went with a scarf on my head. Truthfully, I don't even think I wrote about losing my hair that week. I did cry, and I did laugh, and I did find some words. Being there opened me up to others in a safe and caring place. Charlotte's writing prompts, as you could see, and the creations that come from them are revealing and beautiful and insightful. I hope if you know a woman dealing with cancer, you will make sure that they know about this incredible resource. Today, you get to experience the writing yourself. Even if another form of art is a way that you tend to your soul, go ahead and participate. This is not being about being a poet. It's about letting go and seeing where the words take you. We don't need to be sick to need a moment of whimsy or insight. We just need to be on this human journey, which, by the way, is always best done together. Thank you.
Can you hear me okay? Good, great. I love that we don't just show up as a group of cells, and stopping and listening can actually change the beat of the heart. God, it's amazing. So when you came in, I'm hoping you got this puppy. And on the back of it, it's blank. And you are about to see a picture of 3, yes, those. Yep, that's it. Does anyone need one? We can sort of pass them through. Thank you so much for help back there. You're going to see a picture of 3 owls and a little girl. This is artist unknown. What's that called? Public domain. Public domain, Sweden, 1950s, I think. And I'm going to ask you 4 questions and then 2 speculative starters about this image. So what I want to ask you to do is let go of the side of yourself that's now going, what, I don't write, that is not what I came for. I want you to just let that go and enjoy the process of moving your pen, okay? I will pause for about 40 seconds between the prompts. So I'll ask a question, and then we'll all sit in silence. And your job literally is to keep the pen soul moving. Even if you're saying, wow, that crazy hippie's asking us to write right now. Whatever comes out, just keep moving your pen or pencil. And then I'll give you the next one. So, number 1. Who are you in this photograph? Who are you in this photograph? Are you the owl on the right? And then talk about why. Next one. So you're in the presence of where this photograph is. What sounds do you hear? What do you hear? What can you hear? The third and last question. What is the girl thinking? What is the girl wondering? What is that little girl wondering? And then the last is, I'll start a thought and you finish it. This reminds me of, it could be anything. It could be an aardvark. This reminds me of, And one more of those speculative starters. I like the way it. I like the way it. All right. It wouldn't work very well for me to get people to share because people aren't mic'd up, but if this were a workshop, we would go around and you would share or not, 3 choices. You could say skip, you could share all of what you wrote or some of what you wrote, and then discussion might follow afterwards. And we would write for a lot longer than that, of course. We are very excited to be offering workshops here. They'll be across this, I'm directionally impaired, so it'll be at University Baptist Church, where parking is free. And we're going to start Fridays, March 1st to April 5th, 9:30 to 11 a.m. And also on the front of this card, you will see other opportunities for workshops at Centara Martha Jefferson Hospital, at Yin Yoga, and then 2 other events at WMRA's Books and Brews. And I would like to now, let me make sure I've covered everything because I'm a little bit scatterbrained. Okay, I think I did it. I would like to now open it up for questions. You can ask questions of Susan or of myself, and it can be in any manner. We'll try our best to field them. And should I walk around with the mic?
No,
Okay.
We're going to have a couple of mics available.
Great.
And what I wanted to ask is since we're so close to people having just done this exercise, would it be possible also, when taking the mic, to ask if a couple people
Absolutely.
might want to
That would be
share
lovely. Yeah.
what they'd written?
Sounds great. That would be
And
fantastic.
we could certainly do that, and we could bridge to the questions from there. But thank you for an incredible presentation, and thank you for involving us and trusting us
Thank you all
with
for-
Whistle Words. So when you speak with the mic, we would appreciate your identifying yourself and before you share your writing or ask your question or offer your comment. So who would like to start? We have 2 mics, so we can come to you.
See a hand up there.
Hi, I'm Patrick Henley. I'm a therapy services coordinator here, and wondered, is there such a group for men in Charlottesville?
It took a good bit of deliberation for Betsy and I to make the decision that we would distill it out for one gender, which was a very hard decision. I do not know the answer to that question. I'm not aware of one. Is anybody in the room aware of one?
I actually had the thought this morning, I've been sharing a lot of this with my husband. I was really hoping that somebody would be inspired to start one for men.
I'm curious, too, because on some of the literature, it says women changed by cancer. Does this mean that you have to have had cancer yourself, or is the cancer experience also possibly one that someone close to you
Yes,
has
we
been
have
going
had
through?
we've had several people in workshops. We had a mother of a young girl who had cancer in the workshop. So it is yes, those changed by.
Years ago, I ran a bereavement support group for people who had been affected by cancer. And for some reason, one of our groups ended up being completely a group of men. And it was one of the most unique and powerful experiences that I ever had. And, I wasn't a man, and I was working with Karen Boyle, who also was not a man. And we were just profoundly impressed and touched by that. So I really do hope that a men's group will start along these lines.
So thoughts been offered in the room. Okay. Somebody else with question or writing to share?
Hand there.
Let us know who you are.
I'm Jody. I'm a nurse and former CPE student at UVA Medical Center. I'm curious how you encourage women to take the writing forward after the workshops, to journal on their own or to continue to get together in groups, or how do they continue the therapeutic benefit out of the group?
I don't think I have to do anything because the group ends up usually by the third week taking on a life of its own. And I can give you a concrete example. One of the members of our most recent workshop was recently here in the ICU, very, very sick. And we got together on our own and just did writing, so it wasn't within the parameters of it. There is a sense of, one of the women in that workshop said, it's like you're understood more than family often. And so naturally, a kinship arises, and then somebody will say, yeah, let's start our own, or let's continue on. Sending each other, so a community is created, an authentic, genuine community. Does that answer your question?
This
You wanna, here, he's bringing you a mic. Yep.
Sorry. Charlotte mentioned to us recently the group that Wendy and I are in. Like she said, we're ready to do it on our own. So we have a choice now, like, do we want to continue on, which we may.
One of the things about this book that is so amazing is not only is it the writings that have come from the workshop, but it also has writing prompts and space to just, to write on your own. So this is an incredible gift for someone who's dealing with cancer to be not just something to read, but something to experience. That's right.
Yeah. Other comments and questions? Yes.
I'm Kate Zenker. I was a nurse here for a long time. Can you talk more about the film? We just got the 90 seconds, but it looked really intriguing.
Yes.
Yeah, we'll turn to Betsy.
So what would you like to know about the film? What our plans are, hopefully to do a feature-length documentary, certainly at least an hour, which will be part process, the workshops that Wendy and Sharon and quite a few others who are here, Betsy, Elizabeth, who else did I see? And Anne. There are a bunch of the women from that workshop. We've been filming those for, gosh, a while, since last fall. So the documentary will be part the process, part the product, so a lot of the writing will be brought to life. I like to think of it as sort of visual poetry, and part personal story. And my hope is that the film will have a life of its own, as well as be part of a greater package that would enable this to be replicated. Our goal is to ultimately create a facilitator's guide, so someone could be Charlotte anywhere. And we think the film would be a great entree for women who are possibly considering being part of it. Sort of a great first workshop to hear from other women and see what the process is like. But we also hope the film will be in film festivals and have very much a life of its own. As a producer, I hope it will generate dialogue around cancer and what women are experiencing, so that people don't always talk about it in a whisper or ignore the fact that someone's hair has fallen out, but maybe are willing to step forward and talk openly, finally, about this. So I hope that answered your question.
Thank you. Hi, my name's Paula Rowan Page, and I was a longtime nurse here and just recently retired. One of the things I'm curious about, I love that you have done this in the way that you have shown today and talked about, but I'm curious about the confidentiality piece and how that has, in my career in nursing, confidentiality has come into the arena in a way that I think is both necessary and devastating in terms of the inability to share. And I'm curious how, both with the film and with pictures, you've been able to manage that.
Well, we have, and if I'm sort of clumsy at answering this kind of question, I'll start, but then, do you want to answer it, Betsy? She's clearer than I am.
Yes, we're obviously have been, that was a big question early on when we even decided to start this project. So no one is filmed unless they choose it. We have workshops that are not filmed. This upcoming workshop series at UVA will not be filmed. The workshop series that the women I've pointed out who have participated, they started in other workshop series and then chose to continue and wanted at that point to share. I think it's more likely that women will join the film project in that way because there's a trust that develops and they understand what the project is, and some women choose, find it an empowering process to share that way. Others don't. So we haven't shared any writing from anyone who hasn't given permission, and we certainly haven't filmed anyone who hasn't given permission, nor will we.
And of course, everything that went into the book was given
Absolutely.
permission.
Absolutely,
Yeah.
everybody.
Yeah.
I'm Kate Daniels. I'm actually from Vanderbilt University. I'm just here for the semester. And this was a wonderful presentation. Thank you. I've done a lot of work in healthcare arts, and I too was thinking about the confidentiality issue as you were, various things were presented. But the first thing that occurred to me was that I just want to thank every woman who voluntarily appeared in it. One of the big things that I think about in working in healthcare arts is the stigma that attaches to so many different forms of health issues and treatment for them. And so it's one thing to have a book, that's a kind of it's a wonderful artifact, but it is an artifact to actually see living, breathing images of women and see them in the workshop, and to have you all deliver your poetry to us was really extraordinarily powerful, and I think goes a really long way toward destigmatizing, which has got to be part of what you're doing in addition to what the workshops do for the people who participate in them. So thank you all very much.
My name is Carmel Neal. I'm also a nurse practitioner here at UVA in the Breast Care Center and fellow breast cancer survivor. And I found this very profound in reading this prior to coming to this medical center hour. I had a very unpleasant day at work, having seen some diagnoses that were probably not going to be a good outcome. And I went home and read Susan's poem, and it just brought clarity to my day and how I managed to go to sleep that night, knowing that in some way there are folks out there who are making differences to those of us who have experienced this disease and have aided in my abilities to help share and guide and coach through this process. So the one thing from the film that really stood out to me and brought tears to my eyes, was the picture of the canoe nearing the waterfall. Because there were so many times during my own journey and watching other folks' journeys that I've felt that I couldn't get out of the boat before I got to the waterfall. So I just say thank you, because I'm not one to really speak up and share in public, but I will say that this has just meant a lot to me to be here and share and hear people's stories. And again, just solidifies how I felt about my role as not only a survivor, but understanding what it's like to sit in the chair when I'm providing counsel and guidance to my patients. Thank you.
Thank you so much for your comments. I love the word
Thank you.
you just used, clarity. I think that's sometimes what writing can help bring, is a sense of clarity. And you spoke of that also. Yeah.
Just as a closing question, since all of this has been about words and their extraordinary power and their beauty and their clarity, I also want to call attention and just ask a quick question about the absolutely beautiful and striking, vibrant visual art that accompanied this presentation and that graces the cover of the anthology. Do you want to let us know about that?
Sure. The artist is Misty Mon, a local artist who does collage. And also, Betsy's really done all the work for this, getting the artwork together. But it's Misty Mon and Kristen and a few others. But yes.
Wonderful. I mean, it's such a beautiful complement and contributes to this actually being quite the multimedia project, and a very powerful one, too. I'd like to thank Charlotte Matthews and Susan Goins-Eplee and also Betsy Cox for this marvelous presentation. I'll invite you to come next week, February 6th. Our program is entitled Beyond Burnout, The Healing Power of Fiction. We're continuing in this exploration of healthcare arts, and next week's focus in part is also on the practitioners and the importance and benefits of reading, especially fiction, and citing some research that suggests that reading high-quality fiction can be especially good self-care for busy clinicians who are at risk of burnout. I think we learned today that also writing is a helpful and beneficial experience as well. Our guests next week will be Daniel Marchalik, a urologist from Georgetown, who's also the wellness officer for Washington, for the MedStar Washington Hospital Center, and Hunter Groninger, an internist and palliative medicine specialist, also from MedStar Washington Hospital Center and Georgetown, and he's also a Double Who alum from here. Thank you all for being here today, and we hope you carry this experience and all the things you've learned about Whistle Words away with you today and into the wind, okay? Thank you so much.
Thank you.